So, the Georgia Department of Public Health did something pretty sus recently. Apparently, the Department of Public Health raided a medical clinic in Alberton, Georgia, and took away their extra COVID vaccinations and imposed a 6-month suspension. This is an article from the NBC News. Quote, this small city was still in shock Friday, days after state health workers raided the busiest medical clinic in the county and seized its COVID-19 vaccine supply because staffers had given doses to teachers. Some 470 shots of Pfizer vaccine were confiscated from the medical center of Alberton, a private clinic that had been the largest provider of vaccinations in Elbert County, leaving behind just enough medicine to guarantee second doses to people who had already been inoculated. In addition, the Georgia Department of Public Health said it would not be providing any more vaccines to the medical center for the next 6 months. Quote, DPH took the action after learning the provider had been vaccinating individuals in the Elbert County School District who were outside of the current Phase 1A plus eligible population, the agency said in a statement. There is no other reason for this suspension other than what we have previously stated. But in a January 29 letter to the center, the department gave no warning. It was going to seize the remaining shots Tuesday. Quote, moving outside the phases disrupts the allocation process and creates the potential for many elderly citizens to not receive a vaccination in a timely manner, the department said. Upon enrollment in Georgia's COVID vaccine program, you signed a COVID vaccination provider agreement, which stated you and your practice would not violate any of the state or federal rules related to the program. In an interview, Dr. Chris Rustin of the Department of Public Health said the clinic's actions left them no choice. So, at this point in the article, they actually go on to interview a Dr. Poon. That's his name, Dr. Poon, who works at the facility. This is what he said. We felt that with the state's guidance that teachers were a part of the group, he said. So as soon as we were able to move to vaccinate the essential workers, that's what we did. The first inkling that they might have run afoul of the state was January 26, when the department called asking whether or not we had vaccinated teachers, the doctor said. And at the time, of course, we believed that that was part of the proper procedure, so we said yes, Poon said. And in less than 48 hours, the State Department handed down a ruling that our vaccine status was suspended and that we would no longer be able to vaccinate individuals. The community's reaction? Shock, he said. So here's pretty much what happened. The Georgia State Department of Public Health raided a medical facility in rural Georgia because they were vaccinating Alberton District school employees. They also suspended the facility from receiving additional vaccines for 6 months. That's what happened. And before we say that the State Department, that they're being complete douches, I think it's fair to consider their side of the story. So bear with me for now, and let's give them the benefit of the doubt. If you're the State Department, you don't want people who are at high risk to go without the vaccine. You want a plan for every necessary worker and elderly person to get their shots without any issues. That's what the spokesman said in this article. He pretty much said that they had no choice but to suspend this medical facility's vaccination privileges. He was implying, if didn't outright say, that other facilities could not be allowed to stray because it had the potential of completely derailing the vaccination process. And you know what? If you look at it like that, I'll give it to them. The reasoning does make sense. But here's what does not make any sense at all. It's the way that they went about addressing the rule breaking. And quite honestly, I'm going to call the State Department's outright bullshit on that. Just total bullshit. First off, there didn't appear to be a warning before the raid. According to this article, no chance was given to the clinic to get back on track and to stop breaking the guidelines before the extra vaccines were taken away. I think the right move would have been to actually give them a warning. Like, if they actually cared about getting people vaccinated, if that was their prerogative, you should give the clinic a warning and give them a chance to comply before seizing the vaccines. And I think all of us here would be more sympathetic towards the State Department if they had actually told the Alberton Medical Center, the clinic, that what they were doing was wrong and give them a chance to correct their course before taking such harsh action. But that didn't happen, obviously. So to me, because the State Department didn't give them a warning and didn't give them a chance to correct their actions, the clinic, I mean, it ultimately made the State Department look like a bunch of dicks, the State Health Department. But not only did they bring down the hammer like some sort of like authoritarian dictatorship, the punishment does not fit the supposed crime. Like, come on. They were just using the extra vaccines to vaccinate school district employees. Extra vaccines. These are the teachers that interact with the kids. These are the kids who go home to their parents and possibly grandma and grandpa. Now, call me crazy, but if a medical center had extra vaccines and the first group of people that they vaccinated were school district employees, I would give them a round of applause, because that is the first, minus like elderly folks and nurses and whatnot. Those are the first people that I would want vaccinated, honestly. The kids, they interact with almost everyone. So I can't really blame the Alberton Medical Clinic for not thinking they did anything wrong. This is because it seems to me like that is a humane thing to do, honestly. If your whole mission is to vaccinate as many people as possible to stop the spread of the virus, I think that was a good move by the clinic. And the State Department, by taking away the vaccines and by giving them the 6-month suspension, fucked it all up. They were just, it seems to me like it was just a power move to prove who was boss for no fucking reason. I think, honestly, the more egregious part of this, not just the whole taking away of the extra vaccines, is that the Georgia Department of Public Health made it so that not only did the teachers can't get it from the facility now, nobody can. Because the Department of Public Health actually banned the facility from doing it for the next 6 months, from giving away vaccines for the next 6 months. I think if the State Department's mission was really to vaccinate as many people as possible, they just kind of shot themselves in the foot. They shot themselves in the foot by taking away the vaccines, the extra vaccines from the clinic, and also from preventing anybody else in the vicinity from getting it from that clinic. And unless they are actually ramping up efforts somewhere else to vaccinate persons, to get people vaccinated in Albert, Georgia, then I think they fucked up royally, because they're putting people's lives in dangers because they want to send a message to the other facilities. The message is that any amount of discretion, no matter how many lives it saves or how innocent the alleged perpetrators are, that this Department of Public Health is large and in charge. The Georgia Department of Health, that is. This is my message to the Georgia State Department of Public Health. Okay, you're trying to send a message. You're trying to make sure that nobody breaks the rules. But what you're doing is ultimately harming more people than it helps. People's lives are at stake. People need the vaccine. And if there's a medical facility that goes off the rails, give them a chance to fix their shit. That way we can preserve people's abilities to get the vaccine. Because right now, the way that you acted, the only people you're putting in danger is the people who were served by Alberton Medical Clinic. And I think that's unacceptable. But honestly, not surprising coming from the Georgia State Department of Public Health. Shame on you.